Hello all, I am Dr. Deepa, Lead Consultant in the Department of Obstetrics and Gynaecology, Aster Ramesh Hospitals, Ongole. I have over 2 decades of experience in obs and gyne, and my area of interest is high-risk pregnancy management. We all know that prevention is better than cure. In this regard, today we shall explore prevention through nutrition and how the right nutrients will reduce risks during pregnancy. We all frequently hear about the critical importance of iron to prevent anemia and calcium for bone development during pregnancy. These are undoubtedly vital. However, focusing solely on them is like building a house with just 2 tools. To ensure a healthy mother and a thriving baby, especially during the crucial 3 trimesters, we must pay attention to the entire toolkit of micronutrients. Today, I want to highlight the essential roles of these supporting cast nutrients. The first and foremost among them is folate, or its synthetic form, folic acid. This is arguably the most critical early pregnancy nutrient. Adequate intake before conception and during the first trimester is crucial for preventing severe birth defects of the baby's brain and spine called neural tube defects. It is fundamental to cell division and DNA synthesis. While prenatal vitamins contain a high dose of folate, you can also boost your intake naturally through leafy greens, beans, and fortified grains. Next is iodine. We need iodine for healthy thyroid function, which regulates metabolism. During pregnancy, the demand for thyroid hormones surges. Iodine is essential for the baby's developing brain and nervous system. Severe deficiency can lead to significant developmental issues. Ensuring adequate but not excessive iodine through iodized salt, seafood, and dairy products is an easy yet profound way to support neurological development. Vitamin D. While calcium builds the bones, vitamin D is the key that unlocks calcium absorption. Without sufficient vitamin D, both mother and baby are at risk for bone problems. Beyond bone health, vitamin D also plays a significant role in immune function, healthy cell division, and may even prevent complications like gestational diabetes and hypertension. Sunlight exposure is a great source, but dietary sources like fatty fish or fortified foods are often necessary, especially in certain climates. Zinc. Zinc is a mighty trace mineral involved in a myriad of processes. It supports immune function, wound healing, and DNA synthesis. In pregnancy, adequate zinc is vital for normal fetal growth and development, cell integrity, and maintaining the mother's immune defense mechanism. Deficiencies have been linked to potential severe growth restriction and preterm birth. Good sources include lean meats, nuts, and legumes. Next is choline. Often overlooked but increasingly recognized is choline. It is essential for fetal brain and nervous system development and helps prevent certain birth defects. Choline is a powerhouse for cognitive function and neural tube closure. Eggs, liver, and some meats are excellent dietary sources of choline. Copper. Copper ensures effective iron absorption and utilization. It is an important cofactor in iron absorption along with other trace elements like cobalt and manganese. Magnesium. Magnesium enhances calcium and vitamin D3 function. Few studies have shown a lower incidence of gestational hypertension in patients given magnesium supplements in pregnancy. So in conclusion, we all know that pregnancy is a period of intense growth and development. Early nutritional intervention can prevent complications before they arise. By supplementing micronutrients, we help overcome marginal deficiencies before they become clinical problems. The micronutrients that we've discussed about, like folate, iodine, vitamin D, zinc, choline, copper, and magnesium, all work synergistically. They are the essential details that ensure that the entire masterpiece of a healthy baby is completed successfully. By ensuring a diverse diet rich in whole foods, along with a high-quality prenatal vitamin supplement, expectant mothers can provide their bodies and their developing babies with the full spectrum of nutrients that are needed for a strong and healthy start in life. Thank you.